We've heard the news about vaccines being shipped and administered. The pushback on COVID-19 has begun. But what is the state of COVID-19 right now in West Michigan? Well, we turn to our experts at Mercy Health. Dr. Kim joins us this morning to give us the state of the pandemic. Good morning, doctor.
Good morning.
Thanks for being with us. Can you tell us what is the state of the pandemic right here in West Michigan?
You know, things are much better today than they were about a month ago. And what I mean by that is about a month ago, Mercy Health St. Mary's had, 80-something COVID inpatients, 86 to be exact, when we hit our fall peak on November 22nd. For the past week, we've been in kind of the 40s now, and so about half the number that we had before. The other thing that's happening, which is a really good sign, is that the number of tests that we're being asked to do for COVID and the positive results from those tests have also come down a lot. And so, things are just much better now. And that's thanks in large part to so many people who've been doing the things that they've been asked to do, especially over the holidays, not traveling, not going out, and just staying with their immediate families.
It has been a sacrifice for many, but it's good to hear that it is having an effect. Boy, that's a lot of good news, doctor. Thank you for that. If people suspect that they have COVID-19, it obviously is still happening. What should they do?
Well, there are several things that they can do. First, if they think they have COVID-19, they really do need to stay away from other people until they get tested and get their test result. And there are a lot of ways that they can do that. So, for instance, from Mercy Health, you can go to our website and get scheduled to get the test done. You can also exercise one of many options for getting a professional opinion, including telemedicine or virtual care. The other part of that is it's especially important at that point for people to adhere to really the sensible actions that have helped us to get to a much better place now. Maintain physical distance, make sure you wear your mask, and especially if you believe that you have COVID, make sure you stay home.
You said that the numbers are going down, and that's such great news. Let's talk about folks who just need to get to the hospital. They just need to see a doctor, but they don't have COVID symptoms. Should they still be going in?
Absolutely. I have to tell you, one of the big lessons we had from the spring is that there are so many people who needed medical care who decided to postpone it and not get it. And in the spring, we saw the rates of people dying at home from heart attacks and strokes really go up. And so all fall, we've made it a priority to manage to keep all our services going and open. And so we've managed to do that. And so if there's someone there out there who feels like they need medical care, they really should get it. Whether that's their primary care physician or other provider or something that requires hospital care.
And we just saw the scenes of the trucks leaving Portage as the vaccine is being shipped across the country and really around the world. What's the state of the vaccinations here in West Michigan?
Well, we're looking forward to getting our first shipments of the vaccine later this week and have protocols in place to administer those to our colleagues who stepped up to say that they want it. For us as Mercy Health, as with other Trinity Health ministries, we are not requiring it simply because, it's in scarce supply in the way that I think everyone already knows. So we're really excited about it and looking forward to getting it. And for myself personally, because I get asked the question a lot, when it's my turn, I do plan to get it. I look forward to getting it because I just think the benefits really outweigh the questions about it.
And then you mentioned some ways that we can help the frontline workers. Obviously, the social distancing, the mask wearing, doing what we can to stop the spread. Is there anything else that we could do to support our frontline workers?
So let me first pile on to what you just said. The ways that people can most be helpful to our healthcare colleagues is by doing the actions that we've just been talking about for so long around the distancing, staying home if you're not feeling well, wearing masks, not gathering in large numbers. The other part of it is I think all of us, are kind of tired of COVID and would rather it go away. And so the other thing that I would ask is that everyone stay strong with us and not give in to the temptation of the fatigue that hits us all, because the more of us who are strong and the stronger we are, the quicker this will go away.
Absolutely. Just because the vaccines have been administered and will be administered doesn't mean we should stop with those great measures that have helped slow the spread. Thank you so much, Dr. Kim, for your time this morning. Appreciate it.
That's right. And if I can just add one more thing, I just want to remember that when it comes to the general public, and that includes people like me, who really don't have risk factors, it's really going to be till the spring or maybe the summer that the vaccines are available in enough supply that enough of us can get vaccinated. And so, between now and that period, there's still a lot of months where we still need to stick together and do the right things to keep everyone that we care about in our community safe.
Well said, Dr. Kim. Thank you for that encouragement and advice and great information too. And we at Fox 17, of course, want to thank everyone at Mercy Health and for everything that you're doing, all the frontline workers, from the janitors all the way up to the ICU nurses and doctors. Thank you so much.